As we talk with Patty Olinger, an infectious diseases expert and executive director of the Global Biorisk Advisory Council, or GBAC. And Patty, thank you for being with us tonight.
Well, thank you for having me, Jim.
Let's start, first of all, with the ups and downs we've had with this pandemic. The thing comes on about a little over a year ago, and this is not good. I can remember thinking about last June. Boy, it'll be good when September of 2020 rolls around. This thing will be behind us, which was not exactly the case. And so we went through that entire winter with the flu plus the pandemic, and then come around into this year, and all of a sudden we're reopening things, and people are getting into group gatherings and the like. Things are looking good, and now this, another downer. Just how serious is this?
It's really serious from a standpoint of, again, we don't know truly what the answers are going to be. And I think a lot of people are looking at the fall and the winter coming into flu season, and that season when we're starting to go all back inside, is that we have variants that are starting to pop up, and not knowing how infectious they are, how deadly they are, how our vaccines are going to be protective against them. Folks are a little concerned from that standpoint.
Well, we have the Delta. I've been hearing things about something called Epsilon. Are we going to go through the entire Greek alphabet here? How many variants are there?
Well, we don't know, and that's just it. I mean, that's the one thing about viruses and microorganisms is that they will change, and they mutate, and that's what we're seeing right now. Is some of these mutations are causing some problems for people around the world.
Well, it would certainly seem so. Now, this call now by Pfizer for a third shot, a booster shot for their two-shot series. Can we expect the same thing from Moderna? What can we expect in terms of additional shots being proposed, and what are they supposed to do that the first two didn't?
Well, I think that one of the things that they're looking at is how long will their vaccines be effective, and that what that means is that we produce antibodies, to help fight against the virus, and how long will those antibodies stay with us? Sometimes vaccines will stay for a long, long time, and sometimes, like with the flu shot, or they talk about having boosters. With our animals, we have to have booster vaccines, and that's what we're looking at here is, do we need to have a booster? And that's what they're starting to, get that research behind them to be able to know whether or not we'll need a booster or not.
1-866-50-JIMBO is our number, 1-866-505-4626, with Patty Olinger, infectious disease expert, executive director of the Global Biorisk Advisory Council. What is GBAC exactly?
GBAC, GBAC is what we refer to it as. We're a division of ISSA, and ISSA is the leading trade association for the cleaning industry. We're a global not-for-profit. This last year, we implemented a quality management system for facilities and service providers to help them prepare and respond to this pandemic, but also in the future, so that they're ready in case there's another pandemic with regard to cleaning, disinfection, and what we call infection prevention measures, which includes indoor air quality.
Have we learned enough lessons, do you think, from this pandemic so that we'll be better prepared for the next one? Like, for example, maybe, having enough ventilators on hand, this sort of thing?
We hope so. I think that the concern that a lot of people have, and sometimes a little bit of what we've been seeing as well, is people are tired. They want to go back to some type of normalcy, and who blames them? They're ready to go back. And the thing is that as we head into the fall, and as we're learning more about our vaccines, we know how to protect ourselves. And what we want to avoid is shutting down again. We just don't. We've got to avoid that from an economic standpoint. And so we know how to protect ourselves. If we have to wear masks, we have to wear masks. We, wash our hands. We don't touch our face. Those things that we learned, and we can't forget them. That's really important.
Mm-hmm. In terms of national preparedness, let's say that you had right now the ear of the president, the relevant congressional leaders, the relevant cabinet secretaries, and other parts of the upper bureaucracy, what would you tell them? This is what you should have learned.
Well, what we should have learned is, one, the communication that we had last year was so up and down. And I think that that's something that we need to be very careful about going forward. The other thing is that, again, it's the different things that we can do as a country, looking at how we prepare, making sure that, mask, like for instance, the mask mandate. We know what they do. We know how they protect us, and being able to have more of I would say a national guidance in some way, shape, or form. And I know that's easier said than done. To be able to have that, it was really important. And then learn the lessons that some of the states stayed open, and they stayed open very successfully. And what was it that they did? And let's sit back and look at what they did that allowed them to stay open in comparison to some of the ones that didn't, and then compare and then come up with a really great plan. And I think that there are things that we learned, and there are things that we can do to stay open and to be prepared for what potentially will come next.
All right, as we go to a call here, let's just take a look at the opening versus the closing. Is that a lesson that we learned? Obviously, you cannot stay closed forever. You wind up with even if it is an effective way to prevent the spread of the pandemic. The fact is that people have to eat, people have to have shelter, people have to have heat in the winter, and so on. And so you're trading off maybe one form of death for another. What have we learned about shutdowns? Should we have done it at all? Should we have done it more selectively? What should we have learned from that experience?
I during the pandemic, I actually did a physical move from Georgia to Michigan. And so here I went from a state that was more open to a state that was very, very shut down. And one thing that Georgia did, and I thought they did a great job from a standpoint of how they allowed places to stay open, but they communicated really very, very detailed, for instance, how restaurants could potentially stay open, how even retail outlets, their convention centers stayed open, and what types of things that they needed to do. We worked with a lot of those facilities as well from an accreditation standpoint, doing kind of a third-party look at what they had in place, or SOPs, and they very successfully held conventions and were able to stay open. When I came up here, they were all shut down. But when they opened up, they didn't give them as much guidance. I think people were shut down for so long that it was like, oh, good, we can open up now. And they went from being shut down to almost completely opened up. And it was very interesting to watch. And so when we look at those things, being able to communicate to people what steps you need to be in place, why do you need to have some importance? It's something that it's easier said than done, and I know that, but we can do it. We can stay open as long as we look at different behaviors that we can control ourselves and that our businesses can put in place.
1-866-50-JIMBO for Patty Olinger, Executive Director of the Global Biorisk Advisory Council. Here's David in Creston, Iowa. Hello, David.
All right, thanks for taking my call, Jim, and also your guest. You mentioned a few minutes ago that they were taking more than one shot or at a series.
Well, now Pfizer specifically, Pfizer is suggesting a third shot in their series of 2.
Okay, but why would they do that if something wasn't wrong in the first place? I mean,
well, it doesn't mean something was wrong. What they're saying is that a third shot would provide extra protection, especially for this Delta variant. They didn't say that anything was wrong.
How do they know that? That's what my question really is.
All right. Well, on what basis would Pfizer be making such a request, Patty Olinger?
So what they're looking at is, as they're looking at through clinical trials, basically, through blood samples, measuring the amount of antibody that people still have circulating within their body. And that's something that, they look at for other vaccines as well. The hepatitis B vaccine, for example, is a 3-shot vaccine. And so it's not uncommon to have more than a couple boosters, and sometimes boosters, for instance, I'm going to get it probably wrong, but the typhoid shot is every 2 to 3 years, I believe. So, I mean, it's not uncommon. It's just this one we're still learning, and the Pfizer and the Moderna is a new type of vaccine, and so they're even learning about that. It's exciting, the technology that is with that vaccine, but we're learning still today, which is a little surprising for all of us. But it's not in some respects.
Did we, in the early parts of this pandemic, get thoroughly confused and disillusioned by people in positions of authority who spoke before they were certain of what they were saying?
I think so. I think that we as the general public got confused, and that's too bad.
It's very too bad, because the credibility was lost in that process.
Absolutely. And I think, at times, I think the intention was well, but in the reality is that the general public really didn't understand some of the science behind what they were trying to explain. And so you're right, the credibility. And the other thing about it is that, this was such a new virus that people were learning about. And, we were looking at those public authorities as the experts, and it seemed like they were changing their mind every day. And the reality was they were learning more in some respects every single day.
Yeah, because it would have been, I think, helpful if they had waited until they were sure. But, of course, I suppose as you were groping in the dark, you couldn't be sure that there was more to learn. All right, Kim in Shields, Michigan, for Patty Olinger. Hello, Kim.
Hi, Jim and Patty. I agree with you, Patty, what you said. If this ever happens again, or when it happens, we should never shut down the economy again. But we found out later that it was all, a lot of it was the Democrats taking advantage of a bad situation. But anyways, the two comments I have, and I want your opinion on this. I heard on my shows that, I don't know, I just heard this, that in the fall, there might be another one of these coming our way from the CCP, and this one would be worse because...
The CCP being what?
The Chinese Communist Party.
Oh, in other words, coming this way from China is what you're saying. Okay, go ahead.
Yeah, that fall there might be one coming our way, but this one
by another one. Are you talking about a whole different pandemic? Are you talking about a variant of this pandemic? I'm not sure what another one means necessarily.
Another pandemic, but this one will be different. They said that.
Well, who is saying this? What, like they're whipping them up in batches and they're going to release them one at a time? I'm just curious as to what it was you heard, Kim, before we respond.
I'm trying to tell you what they said.
Well, who are they? First of all, who are they?
It was on one of my shows.
Well, okay, so somebody. Somebody. Somebody said it. Okay, fine. Okay. Let me ask our guest, have you heard about a, quote, another pandemic that might be coming from the direction of China, Patty Olinger?
I have not heard that. I know that there are some of the researchers around that are looking at the fall, while we're talking today, looking at the fall and wondering what the flu season will be this year, because we really didn't have a flu season last year.
Did the flu not exist last year? I mean...
No,
or did we just not pay attention to the flu season last year?
Actually, the behaviors that we were doing, like social distancing, wearing masks, washing our hands, not touching our face, doing a lot more cleaning and disinfection, was really to bringing the viral load down as far as and our exposure levels down. So we just didn't have the numbers that we did last year or the years before. Yeah. And that was a positive thing. But
are there any indications? Obviously, there will be more pandemics. To get back to Kim's question, do we have any indication of any other pandemic coming our way, or is it strictly for the moment just variations of this pandemic?
What I've been hearing is more variations of this pandemic.
Okay. We'll come back and we'll talk some more with Patty Olinger, again, an infectious disease expert, executive director of the Global Biorisk Advisory Council, or GBAC as it is acronymed, and their website, gbac.issa.com. 1-866-50-JIMBO is our number, 1-866-505-4626, as we look at another surge in the pandemic, the COVID pandemic, and just what we need, variations on a theme. But that's what viruses do. Viruses are very simple mechanisms, organisms, if in fact they are alive. You can get a debate going on whether or not viruses are anything more than complicated molecules or living things, but they change, and they change quickly. Patty Olinger, our guest, is executive director of the Global Biorisk Advisory Council. Now, I understand that the Delta variant has already become the dominant strain in the U.S. and that authorities in Australia, South Africa, and portions of Asia have reintroduced curfews, and that further, the Delta is expected to hit the states with the lowest vaccination rates the hardest come the fall. Amplify on that, if you would, please, Patty Olinger.
Absolutely. You're absolutely right. The Delta virus will be, those who are most vulnerable will be those who are not vaccinated. And that's a concern. So those areas in those states and certain areas within states that have low vaccination rates are going to be the hardest hit, is what they're predicting.
All right. In terms of how bad can we expect it to be? Is there any evidence as we go to some more calls? Are there any predictions as to how far back we need to go? Just how much of a relapse, or is this just a speed bump on our way back towards something approaching normal?
That's a really great question. I don't think anybody has the real answer to that, but I think that what we can do is know that, number one, go get your vaccine if you haven't gotten the vaccine. That's important because it protects you and it protects your family and it protects the community. If you, for whatever reason, if you have medical reasons why you can't get the vaccine, wear your mask. Right now, still wear your mask. And as we head into the fall, really be aware of your situation. If you're in situations where there's a lot of people and they're talking about the variant, and the variant is starting to show higher levels in certain areas, especially where you live, then those are the times then we can go back to, for this next winter, wear your mask in public, as far as in public places indoors. Pay really close attention to, hygiene and where, not touching your face, which is hard to do, and washing our hands. Those are the things that we can control. And then pay attention to what the businesses that you're going into are looking like too.
So all the things that we learned to do that many of us have since forgotten to do. Okay.
Very quickly, and I think that's a concern that, actually that was a concern when I was talking to a colleague of mine who is, a researcher in this area at a major university. He was saying that's what they're really predicting, as far as people are forgetting or just wanting to forget what we've learned this last year.
All right. To Jeffrey in Southwest Missouri. Hello, Jeffrey.
Hello. I was going to say that since now there's been studies out showing that this virus can live for 3 days on cotton and 14 days on vinyl and other surfaces, it seems like that these social measures aren't going to do a whole lot in the long run. It might drag it out a little bit, but ultimately we're going to have 100% exposure. And so why isn't there more emphasis on prophylactic measures, like we know that the use of ivermectin and some of these other things can...
What was that? The use of what, Jeffrey?
Ivermectin.
What exactly, for the rest of us, maybe our guest knows, for the rest of us who don't, what is it?
Ivermectin is most commonly used as a livestock dewormer. It's also used for humans in certain instances, and several months ago a physician, I forget his name, testified before Congress as to the use of that in Argentina and some other countries.
Right.
Where
let's let our guest respond here. What about the virus living on exposed surfaces for extensive periods of time?
Well, that was something that we learned really quite a few months ago, that it can live in certain conditions on surfaces. And, while we do know and understand and get that the most likely way that you're going to get infected is by airborne, if you're close to somebody who has COVID, you can get it by touching a surface that has the live virus on it and touching your eyes, nose, and mouth. So we do know that that's possible. So the longer it can live. The way to protect yourself, again, the easiest way is by the vaccine. We know that. And again, wash our hands, don't touch our face. When we start adding in things like ivermectin or something like that, those are for treatment. And that's one of those things where, the vaccine is our best defense at this point in time.
To David in San Francisco, good evening.
Well, thanks, Jim. And I guess I'd have two. I was going to mention we've got a county out here, San Bernardino County in California. They're losing 30 people a day. So, and that's a very rural county that's kind of out near Las Vegas.
Well, it's not all that rural, but it's I guess rural by the standards of Greater Los Angeles, maybe. But anyway, go ahead.
Right. Well, and so they're losing 30 people a day, and they've got I'm amazed at the talk radio down there that still are saying, you're some kind of a coward if you wear a mask. But I was going to ask a second question. The original COVID, as I understand it, was actually pretty fragile. If you think about it as a mineral that's wrapped in a kind of a rubbery coating, if that rubbery coating is broken up, it has no power over you. And so basic soap and water was really recommended. You didn't really need to do all this bleach and special cleansers and whatnot. Just soap and water would break apart that rubbery coating. Is that still true with these variants?
It is still a envelope virus. So yes, I mean it has what they call a fatty layer over it. A lipid coat is what it is. And soap and water. And that's why we talk about washing our hands. The thing about some of the disinfectants, and we've learned a lot. If there's a silver lining here, there's a lot of new technology that's available to us, and the chemistries that are being developed for disinfectants are becoming better and better and more safe, and we're learning more about that, is that they can use, like with some of the electrostatic sprayers, they can use less chemistry and less time and really look at just the high touch points. Because if you go think about a store or think about, a convention center, if you're trying to touch all those touch points, it's really tough and very labor intensive by doing it by, wiping down. So there's new technologies, but yes, that virus, if you can get it, touch it with the soap and water, it's a great way to clean.
All right. To Joshua in Fort Worth, Texas. Hello.
Yeah, I had something that I want to talk about that I always mention. Everybody keeps saying that the flu wasn't quite so bad last year, but the numbers were down. I was following actually the COVID plus the flu at the time around right before April in that area. I was watching the numbers come in, and right about, I think it's April 15th, the CDC put a statement out that said we're no longer tracking the flu. So if you're not tracking the flu, how can you know that the flu was actually less last year?
Well, the numbers that were reported, because it is a reportable disease, is that the numbers were just really low. And you got to remember, all the way through the winter, they were tracking and they were looking at, and those numbers still get reported. So they do know that that when they do test, so if you go in with a lot of symptoms, you're going to be tested for the flu and COVID and other things, and they rule out, some of it's by rule out. And so they do know that the numbers for the flu have been very low.
So in other words, they're not saying that they weren't paying attention to the numbers. They're just simply that there was not emphasis placed on the tracking of the numbers, I gather, is what you're saying.
Exactly. And it's not just our country. They were seeing that across the globe.
as we go to the more calls here, what about the epsilon variation? I just heard it mentioned, but I don't know what it is or what it does. I mean, like Delta, I guess, is more contagious, but I don't know about epsilon.
I haven't heard of epsilon. I did hear of lambda recently. Lambda actually had been identified back in July or August of last year, but now they're starting to see more cases in some countries. So I think we're going to see more of these variants, and they're going to keep track of them, and you're going to hear the most about those who they're worried the most about, that could cause the most problems.
All right, Pat in northern Michigan. Hello, Pat.
Hi. Thank you for taking my call. As far as this Wuhan Institute and all the smoke they've been blowing up our kilts, a bat bit of rat is ridiculous. And
I'm sorry, Pat. I'm sorry. What is ridiculous?
That a bat bit of rat, or however this thing was supposed to be superimposed upon us. It's a smoke screen that they're trying to say.
Well, I don't know. Perhaps you bring a greater knowledge of immunology to the subject than I do. Let's turn to our guest, Patty Olinger. What is the best information you have had as to just how this thing might have started? Again, keeping in mind, of course, that that Wuhan lab was just down the road. That would be like if a pandemic started in this country just down the road from Fort Detrick, Maryland. A lot of people would say that's hardly a coincidence, Patty.
I understand that, and the lab in Wuhan is a high level, what they call a BSL-4 lab, and there is some concern that there may have been somebody who had gotten ill. We don't know that for sure. The fact that viruses do jump, they'll say jump or spill over from an animal to a human does happen, and there are many different examples of that. But they do know that there's the possibility that if a bat, let's say waste from a bat was on grass and it was eaten by an animal, there are those chances, and those are things that have happened in the past, like with hantavirus in Australia, Ebola virus. So we do know it happens, and this is one of the things that's hard to find sometimes, that sentinel or that beginning stage, and they're still looking for how this started.
Or at least we are. I'm not sure how seriously the Chinese are, but that, of course, depends on what they may or may not have had to do with it. Ken in Schenectady, New York. Good evening.
Good evening. Thanks for taking my call. I have kind of a multifaceted question. Number one is what kind of symptoms does the new Delta variant, how is it presenting itself, and what makes it more dangerous than, say, the COVID-19? And on top of that, why would a vaccine make a difference for somebody who already had, say, COVID-19 or any of the COVID variations? How is that going to protect, say, like me, who's had it before, who had very mild symptoms or, let's say medium symptoms? And why, if, say, 95% of us would get it, would have mild symptoms, what is the benefit of taking a vaccine on top of already having it naturally run through my system?
All right, let's let our guest respond to that. First of all, what other than being more contagious, I'm not sure what Delta is supposed to have that's a different characteristic.
Correct. That's correct. I think that one thing is that you're absolutely right. It may be more. It's probably more virulent in some respects, as far as a lot of people are concerned about that. It is one of the reasons why people are really concerned is the people that aren't vaccinated. And even if you've had COVID, you may not be immune to this particular variant. And what they're looking at with the vaccines, here's one reason, is that hopefully these vaccines that we have will protect you against some of these variants as well.
Is that hope based on any particular scientific basis? I'm just curious.
Yeah, some of the areas, like in some of the other countries, especially like Israel and the UK, they're starting to get more and more data and showing that the vaccines have protected folks from getting the virus. The other thing, as far as the one thing about if you've had the disease, yes, you may you will have antibodies. How long those antibodies will stay is still in question, and so it's an extra protection factor getting that vaccine to protect you even more, and especially when you're starting to look at some of these variants.
Patty Olinger of the Global Biorisk Advisory Council as we talk to Don in Pittsburgh. Hi, Don. Well, let's go to Sharon in Crane, Missouri. Hello, Sharon.
Hello, Jim, and hello to your guest. I had COVID in 2019 at Christmas time, and I had a severe case of it. I was not hospitalized. At the time,
this was before the pandemic officially got underway. Were you positively diagnosed as having had COVID as opposed to some other flu-like virus?
I have talked to my doctor, and my doctor has told me that at our whole town of 1,500 people, almost everyone in town had this. And when we all went to the doctors told us it was not the flu. They did not know what it was, but just to go home and take care of ourselves. I was left with a heart murmur, and that I did not have before I had this. Now, I have heard different experts say that if you have had heart issues, if you've had COVID and you have heart issues, that you should not take the vaccine. And there is so much conflicting information out there. I'd like to know what your guest says.
All right. Go ahead, Patty.
I guess I want to make it real clear. I'm not a medical doctor. And so and having two sons who are medical doctors, I would very much encourage you to talk directly to your physician, because only they can answer that for you, because they know your particular condition and be able to advise you on that.
Have you heard about an entire small town in south central Missouri that had COVID several months before the outbreak occurred everywhere else?
No, I haven't. I have heard of just some cases here and there that people presented at the end of December and January and in February, actually, where they were told, we don't know what you have. It's not the flu.
So there were other such cases of that. All right. Well, that's very interesting. Robert in Charleston, South Carolina now. Hello.
Yeah, hi, Jim. I, as a child, I was very interested in the medical sciences. I volunteered at my parents' hospital in the pathology and phlebotomy labs, and I live in Charleston, South Carolina, which has a wonderful university hospital, but they don't allow us to sit in on courses. They do allow us to sit in courses at the Citadel or at the College of Charleston, but they don't let us sit in on the medical university. I don't know why that is.
Does that have something to do with the discussion of the COVID Delta variant or something related to this? We're sorry that there's an absence of access to some courses, but what exactly does that have to do with the subject?
Well, the subject is that there's no place where they, even on the radio or on TV or any place where they tell you exactly what's going on there and exactly how that vaccine works.
Exactly what's going on where?
Well, for example, they have two vaccines that have to be held at I think it's 70 or 90 degrees below 0 Celsius, and one that can be held at room temperature. The first two, you have to have two injections, and the second one, you only need one injection, the Johnson & Johnson. Why the difference? What exactly is going on?
All right, well, we've got a little, about 30 seconds here. Why are the vaccines so different from one another, Patty?
So the Moderna and the Pfizer are called an mRNA, messenger RNA vaccine. It's a new type of technology that they're using, and so they require different requirements for storage, and that was they have to be stored very cold. The J&J is more of what we would call a traditional vaccine. Things that how they made them, they're very similar to the way they made them.
Didn't require it. So they're different, I guess, because they're different. All right. Stay on the line if you would, and we'll speak off air. Patty Olinger, infectious disease expert, executive director of the Global Biorisk Advisory Council, or GBAC, GBAC. I'm Jim Bohannon, and this is Westwood One.